Hello, my name is Trina Rose Cerezo Fox, and today I'll be performing this skill video of deep tendon reflexes for Nightingale College. This here is my volunteer, Michael Cerezo Fox. And Michael, do you understand and consent to participation in a demonstration for the skill video and being recorded for internal purposes such as grading and program review by faculty and institutional accreditation?
Yes, I consent to both participation and to being recorded.
Perfect, so now we can go ahead and proceed. I will start my video by performing hand hygiene, introducing myself to the patient, and closing the door or curtain for patient privacy. Deep tendon reflexes are used to assess for preeclampsia or eclampsia in a pregnant woman. And if it is a 0 for the reflex, that means it's absent. 1+ is diminished, 2+ is normal, 3+ is brisk, and a 4+ would be hyperreflexia. If it's a 3 or 4+, then that would indicate high risk for seizure. If it's 0 or 1+, that would indicate magnesium sulfate toxicity. Deep tendon reflexes are used to assess for involuntary muscle contractions that could determine if there's neurological dysfunction. So I will first start with the bicep reflex. I will first have my patient relax their arm completely onto their leg. I'm going to press down, grab the reflex hammer. We're going to use the pointed side. I'm going to press down on their bicep tendon. If you cannot find it, you can have them flex their arm. Go ahead and flex. And you can feel the tendon. Go ahead and relax. And I'll press my thumb there. Again, make sure their arm is completely relaxed. And we're going to use the pointed end and hit your own thumb on that bicep tendon. And we are observing for a involuntary muscle contraction in the bicep area and or some reflex in the forearm or the hand, which we saw. I'll do it again. Okay, next we'll do the tricep tendon. Again, their arm must be completely relaxed. I'll support it with my own arm or my hand. We will locate the tricep tendon by identifying the elbow, and just above the elbow is where the tendon is. So again, we'll use the pointed end and we'll tap right there. And we saw a little reflex there. Next, we'll locate the patellar tendon. So you find the kneecap, just below that is the tendon. We'll use the flat end. And we saw a reflex there. And then next we will assess for the Achilles tendon. That will be, we will find the heel and just go above that. Again, we can use our flat side for that. And then also I'm going to use my hand to slightly support and dorsiflex their foot. The proper way that we know that we assess the reflex is they will slightly do a plantar flexion of their foot. One more time. Okay. And then lastly, to assess for clonus, again, I will dorsiflex their foot. A normal response will be their foot will go back to dangling as it is right here. Abnormal response, there would be 3 to 5 shaking going as their foot goes back down. So I will go ahead and dorsiflex their foot and release, and normal response. I will then place my patient in a comfortable upright position, make sure the call light is available if they need it, and hand hygiene and exit the room. Thank you.